So, dear searchers of the truth, as we are all, when the patients come to you and say, "Doctor, I have cancer. Doctor, I have AIDS. Doctor, I have multiple sclerosis. Doctor, I have a chronic hepatitis. What can you do for me?" The first thing that you feel, that I feel, is something here. And as they say yesterday evening, you know what it means here. It's anxiety. And if you stay in the anxiety, you don't do anything. But if you try to go deeper for the people, for that human being, maybe you can do something. I'm working as a homeopath, and I've been amazed by looking that the nature often uses our similarity law. And as I show you this morning, you'll see that the similarity law, we can use it for many, many products in many, many severe diseases. But first of all, I have to recall you some important facts that science showed us in immunology. And you will see, as Dr. Krause this morning just before me showed you, that bis repetita placent, as said the Roman, but if you hear it twice, it's better as once. And therefore I shall show you some slides of it. That's our blood cells, white blood cells. And it's very important that you know what we will use here. We're starting from a hematopoietic stem cell, which is in our bone marrow. By dividing, it's giving two other cells from the lymphoid line stem cell and from the myeloid line stem cell. The lymphoid is going through the thymus from a part of them and given different specialized cells. Forget the first one, it's not important for us. That's the T8 cell. It's a cytotoxic lymphocyte, CTL. The T helper is a T4 and the T8 suppressor cell. These cells are going through the thymus and get specialized there. Therefrom, they called T cells. Other cells are not going through the thymus. They get the specializing in the bone marrow, and therefrom there are B cells. You have B cells here, and under stimulation they become plasmacytes, which are given antibodies. There is another line very important. Actually, it's not known how is it working from its specializing, but it is sure that it's not a T and not a B cell. Therefrom, we call them null cells. It's non-B, non-T cells. And you find in these cells 4 different categories: the killers, the natural killers, the lymphokine activated killers, and the tumor infiltrating lymphocytes. I shall talk about all these in my lecture. On the other side, there's only one thing which is interesting is here, is the monocyte, which is transforming in macrophage. Right. And now is coming the big part of the puzzle. Don't worry, it's not difficult. No, really, you'll see it. So it seems, but it is not. As I told you about the bone marrow here, you'll see different cells which are going through the thymus, T8 and T4 cells, the B cells, and the non-T, non-B cells. Okay, what's happening now? Look here, that's an antigen. An antigen can be a virus, can be a microbe, can be a part of an immunological biological product which is not recognized by our body as being from ourself. The goal of all this is to destroy that and the structure which is bearing that, because the most important is that that which is not from us is dangerous for us and can harm us. So what's happening? First cells which are coming in the fight are the monocytes and the macrophages. What are they doing? They have receptors for the antigen. They recognize it. They take it and they digest it. And what's happening? They take a part, small part of the most immunologic part of this antigen, and they put it on their surface here. So you see here these little green hooks. And I tell you about something else now. All our cells are ours, and they are specifically ours. It means that we have a system, which is the HLA system, the human leukocyte antigen system, which is so developed that we are all different. And you know, as it's very difficult therefrom, because of that system, to have graft problems. All our cells have the HLA class 1, all of them, which is divided in 3 groups, but it's not important here, it's A, B, C. And some cells which are immunocompetent, and only these present the class 2 HLA. This is DR and DQ. When you take this part here, for instance, we start here, it's important. The immunologic antigen coming in here is brought on the outside of the macrophage near the HLA system. What's happening then? Well, 2 things are happening. First of all, when it happens, the macrophage is giving interleukin 1. You saw it on the slide from Dr. Krause. It's giving interferon alpha 2. And a T4 cell has a receptor to recognize that complex here. When it recognizes that complex, what's happening in the T cell? It becomes activated. It means it receives a receptor for the interleukin 1 and the receptor for the interleukin 2. And now we are in the nucleus of the problem. Interleukin 2 is secreted by our activated T4 cell, which is called T helper, because it will help, that cell will help the whole reaction. The interleukin 2 is secreted by the T helper, which has a receptor for the interleukin 2. So it is an auto-entertained mechanism here. The more it produces, the more it activates. The more it activates, the more it produces, and so on. We'll see how that the nature found a structure to stop that reaction. Interleukin 2 is giving other actions. It's acting upon the T8 cells. It's acting upon the B cells, as you see here. It's acting, I show it in the next part of the slide because it's a little bit too short, on the LAK, on the leukin activated killer cells. Okay. What's happening here? A part of the antigen is brought here nearby an HLA-1, recognized by a T8 cell, which becomes a receptor of the EL2 and begins to divide 2 groups, the T suppressor and the cytotoxic cell. Take first the cytotoxic cell. Cytotoxic cell, the T8, begins to divide, brings a lot of cytotoxic cells which are able to recognize the target cell. First attack of the target cell, which must be killed and removed. Other part here, the T8 are making a suppressing cell. That suppressing cell has, in the time, a receptor for the interleukin-2, and after a certain time of reaction of all this, it stops the reaction upon the interleukin-2 and the T helper. And so that action is stopped. Otherwise, it will be too strong and would be harmful for the body. Now, what's something else about the T helper? He can help the B cell, which has receptors for the antigen 2, which will start to divide under the interleukin-2 influence, but also under other influences from interleukin-4, 5, and 6, which are stimulating factors for the B cells. This development here brings them on specialized plasmacytes, which are giving antibodies. These antibodies can recognize the antigens and bring the reaction on too. They can also come here on the target cell, and they are binding on the target cell. Now is happening something very important. You see here the non-T, non-B cells. I bring them down to here, and I bring my slide up. Non-T, non-B cells, first of all, you have the killers. These killers can attach on the target cell through the antibodies and so destroy it. There are other non-B, non-T cells, the natural killers. These are coming, and their function is to attach specifically to the target cell and destroy it directly. They are the LAK cells, activated killer cells, which are activated by the EL2, the interleukin-2, and can destroy the cell. That cell is 100 times more active as the natural killer cell. And the fourth, not least, is the TAL, is the tumor infiltrating lymphocytes, which is 100 more times stronger as the LAK cell, 10,000 more as this one, and specifically goes into the tumors and destroy them. There is another way of activation. So you see now the target cell can be destroyed by the cytotoxic cell, by the tumor infiltrating cell, the lymphokin activated killer, the killer, and the natural killer. It's not enough for our system. You see here the macrophage can, in certain circumstances, always directly attack the target cell or indirectly. I told you here about interleukin-1. As Dr. Crowe said, it brings the temperature up, but it activates too, first of all, the T8, but also, here as you see, you follow that line, and you are coming on the macrophage, which is producing TNF. It is a tumor necrosis factor, and is producing EL1, which is reseated by the macrophage, which can make EL1 and so on, just as for the TH here with the T helper with the EL2. The TNF has an action as destruction of the blood vessels of the cancer. It has always an action in the blood cells in making clots. It can have an action as demineralization, as cachexy and fever from the patient, as we see for many patients who have cancer problems. Right, now, after that short explanation, how do we work in? We are working in a group, and one of us 21 years ago started to find something very special. He had some cancer patients, and he gave them give them RNA, normally in ample, so to inject, just to give them a little bit a jump in their energy. And he had some very important success with it, because not only the patients were better, but it happened something special. Their cancer stopped at the level where it was. So patients who could not be operated stayed with their cancer, and they improved. And actually, we have still patients who are under the treatment since 20 years, and who are still there, but their cancer is still there. The RNA, as it's been used, has been dynamized. Homeopaths have a very bad habit, you know. They dynamized all what they found and see what is given. Well, here the RNA is given on that slide, and on that picture, something very special. RNA is inducing interferon and TNF and activates the monocytes. So we have the whole part of the first picture, which is activated through RNA. DNA has more or less the same action. It is more a global activator from our nucleus process and structures. There have been many experiences made on animals with these products. And always we have the same result, that dynamized RNA and DNA prevent animals from getting their cancer, which is made artificially by 2-aminoacidofluorine, by dimethylbenzentracene and so on, but not important here to go in such details. You know that we have in our genes, and that's the next part of my reflection, different proto-oncogenes. What's that? We have in our genomes parts of information which are given us, which allow our body to grow when we are in the uterus of our mother. When that part is finished, these genes are completely blocked. Otherwise, we would be maybe 5 meters high and 3 meters large. Fortunately, it's not so. These oncogenes are blocked, and strongly blocked with different mechanisms. In a virus, these antigens are very stimulated. So in some kinds of virus, if you get it in your body, the DNA or the RNA can get in your DNA and can remove the proto-oncogenes on the blocking of your of the proto-oncogenes and make them stimulate, and so you can become cancer. Right. How can you become cancer? Because these proto-oncogenes, which are becoming oncogenes, are making growth factors. And one of these growth factors are the epidermal growth factor. It's a factor that we found in the pharmacy, and we made a potentialization of it, and we gave it to our patients, and we got good results with it, with the DNA and the RNA. And this time, what I'm giving you is a little history at the same time. One of your fellow countrymen, Professor Rosenberg, got a very good idea. He saw that certain kinds of leukemias had good results when he took from these patients some white blood cells, made a cell culture with it, and put in it interleukin-2. This interleukin-2 activated the leukin-activated killers. When it was activated, he re-injected these cells to the patients with large amounts of EL2. Problem was that there are side effects which are very, very important. First of all, side effect is that the patient is taking more than 10% of his weight in water, and it can make lung edema, which is very important, and therefore it must This treatment takes place in intensive unit care with intubation and so on, and costs about $30,000 each time. And there is a second effect, and you'll see it's very important for us, that effect is that all these patients suffer then during or after the treatment for a certain time from pain in their articulations. So we tried with this interleukin that we found easy in pharmacy, we dynamized it and gave to the patients some low potencies, 3CH of it, and it was the first eradicating treatment that we had against cancer. One thing is important in that case, that patients who have leukemia, the interleukin-2 is a growth factor from the white cells. Therefore, if you give it in low potencies, maybe you can stimulate it. It's dangerous, so give it in a high potency and take a 7CH. I'll tell you about it later. In that time too, some immunologist in France, Dr. Roudier, found something very special. He was always working with polyarthritis, rheumatoid polyarthritis, and he saw that these patients had all in their pathology the same problem. The HLA-DR from the class 2 were on the cells from the articulations, which is not normal, as I said, because the class 2 HLA is only on the immunocompetent cells. So it means thus that these cells, which express it as on an aberrative way, are attacked through by our immune system, and therefore they are auto-destroyed. So what did they try? They'd say, okay, we shall try to protect these HLA, and so they used a monoclonal antibody against it, and they put it under the skin by an injection. They had very, very strong side effects, and they said, it's crazy. How is it possible? Maybe it was too strong, and they began to dilute and dilute and dilute and dilute. And they arrived about a dilution, not a potentialization, just a dilution of 900 CH. It's very high. So you have not the potency. They just take one drop in 99 drops of water. Take there from one drop, 99, and you do it 900 times. You see the time that it needs. And they had still good effects, and after so high dilution, they had no side effects. We said for us, why not try it in homeopathy? Because these patients need it 3 times a week under the skin, an injection. They have to go to their doctor to give an injection. It's a lot of waste of time and money and so on. And we said, why not try it by the sublingual way in preparing in homeopathy? But because we are simply dynamizing the problem, the substance, we are not able to go so high, and we try to go to the 30th CH potency. What was amazing is that what's important is the scale of going, and we went from 3CH, 4CH, 5CH, and so on to 30CH. And what's important is that we saw that the results, it's important in that scale of going from low potency to high potency, to break down that autoimmune disease. The HLA-DR is acting in the similarity way. Why? You see here the class 2. We try to protect it. Okay. If we take a monoclonal antibody, it's something against it. Okay. If you make a dilution of it, you become the reverse of the effect, and you have the similarity of that. So by giving that in homeopathy, you can have a result from similarity. We had another product used by Dr. Roudier in France. He took a rabbit and he made an injection of an immunoglobulin G. An immunoglobulin is already an antibody. If you give it a human antibody to a rabbit, he's making another antibody. And I'll make a picture for you to make it understandable. You see here, that's the antigen, called in immunology the epitope. That's part here in blue. You are making against it an antibody. It's an idiotype in red here. If you inject it to a rabbit, he's making his own antibody against it, which is an anti-idiotype, which has the same structure here as here. Therefore, we are in the law of similarity, seen in the physiological way. So, if you are giving that substance to a patient, you can make a mimic of that, and you can have a good result. How did we do that? Well, as I told you, in the autoimmune system problems, the system of the immunity is working too hard, and we have to break it with the HLA-DR monoclonal antibody that we call protection of the HLA-DR and call it pHLA-DR. Here we have to stimulate when a patient is working in a lowered immune system. It means viral problems, even AIDS problems, and cancer problems. Why? Well, if you get a virus, it means that your body is not strong enough to fight against it and let it out. If it's coming in and can do its own work inside yourself, it means that your immune system is lowered. So you have to strengthen it, and to strengthen it, you can give that similar product as this one here, which is this PAA, as we call it. Why PAA? It's a polypeptide, it's the P. Anti-ATPase. Why anti-ATPase? Well, when a virus is coming in such a white blood cell, for instance, it brings on the membrane of the cell some ATPase. And these ATPase are responsible for a lot of reactions, as you know, as we saw on the slide, on the first slide. So what we are doing here is giving a product which is a similar. It's always homeopathy in the same way, to protect and to strengthen the immune system against it. So, now, I know it's very difficult and it's very annoying because it's very technical, but it's important. The first AIDS patient who came to us was in October '84. And we just read something special about it. You've heard a few years ago that in France, Professor Andrieux and even made a press conference and said, we got the solution against AIDS. The solution was cyclosporine. They had 5 or 6 patients who were under treatment with cyclosporine, and they got much more better. And they made a very quick press conference to say, we got the solution. Fortunately, that it was very quickly, because 3 days after the press conference, all the patients died. Yeah, it's yeah, it seems completely crazy, but it's not so. They had an idea about the cyclosporine. For them, cyclosporine is working on the T4 cells and destroying the T4 cells which are infected after their passage through the thymus, and they are not affecting the T4 cells before they are going through the thymus. So they had the idea, we do destroy all, and afterwards the new ones who will come, they will be completely virgin about virus and patient will be cured. What they do forget is that cyclosporin is very toxic. They gave cyclosporin to the patients. They had a similarity low. Why? Because cyclosporin is attacking specifically the T4 cells as AIDS virus do. But it is very toxic and the patients are so weak that they all die from side effects. So it's easy for us to do it as a homeopath. You take the cyclosporin, you dynamize it, you potassize it, and you give it to the patient, and you see that it works, and that's completely fantastic. Our first patient now came to us with a stage 4 full-blown AIDS. Is actually only seropositive, working, get his weight back, has no more infections, and is completely good. Since then, a lot of patients came to us. Belgium is a small country, as you know, so we have few people, many sick people, but if you take the percentage rates, of course, it's not so much. We have about now in our group 70 patients. They are all good. And one of our friends found a doctor abroad who made an experience with it and said, okay, I'm not homeopath, but I have a lot of AIDS patients in my clinic. I would try to make an experience with it. And we started with 60 patients. And normally we do stop the first count, not the treatment, but the first count for the results end of October. And you normally, in beginning of next year, you'll read something in some scientific paper, I hope it's. Because the results are so amazing that it's incredible. Only 3 patients died. 2 first died after 2 weeks of treatment because they were so far that it was impossible to do something for them. The third one died after 6 months. It was so far, and he stayed on a good level, but just on the level from life, and afterwards he died from a malaria. So I think that part of treatment is very important because it's not harmful, it's no side effects, and patients get good. What I can say from it too is that the T4, T8 radio T cells not changed, and it seems completely impossible, but most important for us is first of all that the patients feel good, and until we are finding the complete solution, and we're working on it, and some other molecules actually dynamized seem to have some good hope, give us some good hope for going deeper in the reaction of AIDS and for the patients, but they are still there. Another side of the treatment is, it seems completely incredible, I know, to touch so many sides of pathologies, but all these pathologies are working on one place of the body, let's say, so of one organ, which is the immunologic system. And that part is the virus from EBV. I know there are a lot here in the United States which giving problems. Hepatitis, chronic hepatitis, and so on, cytomegalovirus, and so on. Well, if you give the patients only DNA, RNA, and PAA, the anti-idiotype I told you from the immunoglobulin J, in 2 weeks, patients improve. The results of the lab are better, and in 1 month you don't speak about anything about disease. Another side of the treatment is treatment of multiple sclerosis. Multiple sclerosis is a very difficult MS to treat. And after a while of searching, we found something very special in that disease. First of all, it seems, and I say it seems, that patients, first of all, have a certain ground to make it, as all patients have a certain ground to make different kind of disease in different circumstances. What's happening then? Well, they get virus in certain circumstances, and that virus make they immune system low and stays low for a long time. And after that long time, the body reacts, but on a bad way, and is given an autoimmune disease. And that autoimmune disease is acting against the myelin cells in the I say it in French, but I forgot it in English. In the spine. What's happening then? Well, we have to first of all give these patients a blood test, and if you see that T4, T8 ratio higher than normal, you can say these patients are in the autoimmune way of reaction, and you give an autoimmune disease. And after a while of that treatment, you see these patients getting an infection, kind of an infection, and you know that their part is finished, and they got now the first part of their disease, which is the viral part, which is the lowering of their immune system, and then you have to strengthen it back. And what is marvelous then is in all kinds of these treatments, you find symptoms back from the patients, symptoms from before their sickness, and then you can use a homeopathic remedy, for instance, to remove all that, and then they are cured. What's very important in all that too, of course, and Dr. Krause spoke about it, and it's very important, is of course the holistic approach of the patient. What I told you here, it's an emergency treatment so that patients stay alive till we find better for them. But they have to help themselves too. It's very important by a Simonton treatment, for instance, by for us listening to our patient, by being there to make relaxing therapies, to help themselves to be themselves, to get self-confidence, and that's very important. And here we can help by what we are and by a treatment. And a treatment can be all what we spoke about and we will speak about here in the Congress. It depends on ourselves and what the patients are themselves. And everybody must feel what he has to give to his patient and what's the best thing for him. So I make a rapid tour of all what we could do. Something else we could do, and it seems always amazing. It is not here in my paper because I had no time to write it. Patients with Parkinson react good on that treatment, autoimmune disease. Patients with thyroiditis from Hashimoto are reacting. Young patients with diabetes are reacting if the diabetes is young. It means that the pancreas has been attacked as an autoimmune disease. And I've got a patient who called me, her husband called me and say, yeah, my wife has problems from Parkinson and had problems from autoimmune disease in the legs. They had not phlebitis, not wait a minute, it come back. When the arteries are going slower and slower in smokers, you know. Right, okay. Well, I gave her a treatment. She came to me and said it's much more better, but what we don't understand in the lab of the clinic is that I had a diabetes from 3 grams, and now it's completely normal in 2 weeks. First of all, I made another analysis to be sure there was not an error, and it was right. She's completely cured from her diabetes. It seems impossible, but it's so. So, if you like, I shall project you quickly our prescriptions, so you can read something about it, and if you like, I can give a paper of it to Stephen Ross, who can make, if he likes it, some photocopies about it, because otherwise it will be too long for you to write all that. Formula 1926. Why 1926 is the birth year of the man who found it. And once again, we try to make it simple for everybody and hold the same. You know, here we're prescribing RNA and DNA. These prescriptions are made in Korsakoff dilutions that we find in homeopathy in Belgium, 6, 12, 30, 13, 200. Each dilution is a powder put in a capsule. 6 is number 1, 12 number 2, and so on. Then number 6 is DNA, 7, 12, and so on. And you repeat it. 5 from these, and so on. To make 30 or multiples of 30. And patients is taking one every day. If you prescribe it, it's easy for the pharmacist. You put formula 1926, 30 powders or 60 powders. It was the first formula that we found 21 years ago to make the balance between the patient and his cancer. Here you find the combined formula. Easy to prescribe. You prescribe combined formula number 1. RNA, DNA, EL2, interleukin 2, the PAA, I spoke about it, and the PHLA-DR. We are in cancer. The immune system is lowered, you have to stimulate it. So we are going from the high potencies to the low potencies. We made a box from 90 powders. When finished, we get for the other patient, for the... Sorry? To lower it. The second combined formula is a formula which is used. It's the following from the first. RNA, DNA, EL2, PAA, and PHLA-DR from 16CH to 3CH. One capsule every day. And when that is finished, we are coming on the formula that we always used and as a continuum after it, where you see the PAA and PHLA-DR in 3CH. The EGF, is epidermal growth factor. You find here a product that I didn't speak about it. It's TMSO, it's dimethyl sulfoxide, which in vitro can give some normalizations of cancer cells to normal cells that we use here in 9CH. And when patient finished his box, he repeats his box, and it's the maintenance formula. Now in cancer, it's very important to know that your immune system can work better when he has less cells to kill, of course. Therefore, all methods used to lower the quantity of cancer cells can help the patient better. So is it surgery, is it chemotherapy, and so on? It can be helpful for the patient. And what's very important is that the patient, under chemotherapy, for instance, with such a kind of treatment, sees the side effects of that heavy therapy very lowered. It's very comfortable for him to be under that therapy, which normally can be stopped very quickly. For instance, I got some patients, and oncologist told them we have for 18 months chemotherapy, and they could stop after 6 months, and only 6 inductions of chemotherapy is much more better for the body than the rest. We use that formula when the patient has his cancer which can't be removed. So inoperable cancer, or cancer which is completely unreactive against chemo or radiotherapy, and we still use that formula after for maintenance. When you have a patient who is completely cured from his cancer, it has been took away, cut away, or chemotherapy, well, we will use the whole formula for once, and afterwards we stop it and give the formula, the first formula that you said, maintenance to the organism, to the body, to hold it on so that it can't make another cancer. And that's very important, because it has an effect of prevention only in patients who got the cancer. We made some information, we made some experimentation about mice and rats, and we gave them some RNA, DNA dynamized before giving them the cancer. It's very easy to do that in a laboratory, and we saw that these patients, that these rats or mice, got easier cancer if they got their RNA, DNA before we gave cancer. So the marvelous idea of giving to everybody of us all every day a bit of that failed. But for patients who got the cancer, and the same in a research therapy upon animals, you find that it's protective for the cancer which is there and for making another cancer. Rapidly, the autoimmune disease. 3 boxes again to go from PHLA-DR from 3 to 15 and from 15 to 30 CH. Why? Because here the immune system is too hard working and we have to break it down to bring to the normal. And therefore we are going from the low potency to the high potency, as I told you. Using against RNA, DNA, which are stimulating, but in these dilutions which are high, they are breaking the system. EL2, high dilution to break that system on the activated T lymphocytes. And I put here in our formula 3 times your choice. Here you can put the remedy of the patient, an organotherapy or something else, or nothing if you like. Why did we? It's easy to prescribe it. You put box 1 MAI. Why MAI? It's in French for maladie auto-immune, autoimmune disease. The same for box 2 and box 3. Box 2 MAI, box 3 MAI. And now maybe the most important of all that is the heavy viral infections here. RNA, DNA, PAA, that's all. Crazy, but that's all. Coming from 30 CH to 3 CH, from 12 to 3 CH, and we hold it here. That's all you have to use for EBV, for cytomegalovirus, virus, and so on. If it's an AIDS patient or a seropositive HIV patient, you just add CCS, cyclosporin, 5CH and 9CH. And you make 3 boxes again. Why from 30 to 3CH here, through the whole boxes? Because the immune system is lowered, we have to stimulate it. So we have to go from the high dilutions to the low dilutions. CCS is staying on the same dilution. It's working, as I said to you, specifically like a similarity law on the immune T helper, which is the target of the HIV. How do you prescribe it? You put here only box 1 and S for, in French, SIDA, which is AIDS for us. Box 2S from 12 to 3CH, and afterwards you're continuing with your box and that's the maintenance formula. RNA, DNA, PAA, 3CH and CCS. That's actually all we're giving to our patients. And actually we can say we can stabilize them, bring them back to their seropositive state, but I never could say you, and I did not say we cure them. It's very important because that cure for me is the whole patient who has to be cured. Not only his immune system. His immune system is between his body and his mind, right? But his immune system is very important. It's a system which is a part of the whole. And it's the whole which must be cured. The whole person, the whole being, and the mind first of all. And I think that everybody can't take an AIDS or whatever disease if his mind is not ready to get it. So if you're not asleep, I'm not, but I don't know for you, I'm ready to answer your questions if there are some. Please speak in the microphone and do it slowly, because my language is not so easy as yours in English.
Marvelous presentation.
Thank you.
When you are treating your patients, once you've established the diagnosis, is your treatment always according to your formulations, or do you vary them patient to patient?
We always verify the diagnosis. Many patients are coming to us saying, we've heard about you by another one, and so on, and we have that or that for an infection. First of all, we have to verify that. So it's very important, because otherwise you don't know where you're starting in such a heavy treatment.
No, I understand you verify the diagnosis, but I guess my question was, does every patient with a similar diagnosis receive the same treatment according to your formulations?
As I told you, I said my answer is yes to your question, but I have to make it more precise. I'm working on a system. It's the immune system. It's a part of the whole body, and that part is somewhere not all right here. We try to stimulate or to break it. It depends on what it has to do. And to do that, we give the same things on the patients, because we, all of us here, make interleukin-2, make interleukin-1, make interferon. I didn't speak about interferon, but it comes in the formulas too. But you see, it's important that you understand that that part of that system has to be all right. And afterwards, you can give the individual treatment to the patient. And that's important that it's following it. So my treatment here alone is not enough. It's a part of the whole. But the whole is the individual. So what I'm giving to all patients with AIDS, for instance, is the same treatment. But maybe they will develop, for one, a phosphorus picture, another one a sulfur, another one lycopodium, and so on. Then he will receive his personal treatment, which is coming on the top of the treatment.
My last question, are these formulations available here in the United States at this time?
No, they are not. But that's not a problem, you know. We have a lot of people who are working with us in France, in the Netherlands, in Belgium. It's a small countries, and now if you look at from here, from the United States, but Belgium is a marvelous country for homeopathy, because you can potencize all what you like, even this clock if you like. That's not a problem. You can do all what you want. And therefrom, we can send everywhere our treatments abroad. Some treatments, some formulas here, the PHLA-DR and the PAA, you can't find it in France, for instance. There is an interdiction, but if you have a patient who needs it, what will you do? You go through the interdiction. And we are doing it so down. You make a receipt. The patient sends the receipt to Belgium. It goes very quickly. He receives the bill, pays the bill, and is checked immediately the treatment. And all the thing can be done in 1 week. It goes very fastly. And it's very important, because I know here that the law is so made here that in the United States there are only a determined amount of remedies which are allowed. The other are not, or not yet. And actually you have to do it, otherwise you can use it.
I have an announcement to make. Can I ask again that we hold to keep our schedule going.
Okay. Thank you.
Excuse me, could I ask just one question, please? I'm a holistic veterinarian, and we have a contingency here of about 6 or 7 veterinarians who are doing holistic modalities in treating the animals. We now have an AIDS virus in cats. It has just been discovered 2 years ago, and it is a terribly devastating virus. It is terminal, and it's a very cruel disease. We have nothing right now that will touch it, not even making the noso from the virus. It's very difficult. Would your group be willing to do a cooperative experimental research program with your potentized homeopathic remedies?
Of course, why not?
With us here in America?
Why not? I'm ready for everything. All what I want is that patients are better, and that's the reason why we are all here. And we are. And the truth has to go through us, and we have given from our time, from our energy, from our life to go to the truth. That's what I mean, and everything is all right if it's not harmful. That's what I mean for the experience for all.
Well, I think that's why we're all here, is to do a networking of information and to progress and evolve. And I know I myself would be willing to do this, and I know there's several other members of our veterinary group that would be willing to enter into this
Okay.
with you if you would be willing.
You will see us then afterwards
Yeah,
privately,
I will.
okay.
Thank you.
That was a wonderful note upon which to end, because it is what the conference is about. And we hope that all of you, on all of the topics, can network and share and create the next step beyond what we have heard here. And I'd like to take this occasion to present you with a plaque on behalf of the World Research Foundation, and thank you for coming to share with us.
Thank you very much.
You're very welcome.